And we're back now with Sunday House Call and the doctors. You know that over a third of Americans suffer from high levels of the bad cholesterol, that's LDL. And they could take medicine if they want, like statins, to lower those numbers. But it turns out that many people who could benefit from those drugs, about half, well, they're opting not to take them. That according to a new study from the CDC. Dr. Siegel, why is this? You'd think that if you have high cholesterol and you got these great medicines to deal with it, you would take it.
You know, Eric, I'll get to that in a second, but I want to start by saying they're also not doing lifestyle changes. They're not eating right, they're not exercising right, they're not losing weight. That's a huge number one here. Now, in terms of the statin drugs, I want to talk about three groups that come to my office. Number one group, you already have heart disease or a stroke or angina. You should be on a statin drug. That's the first group. Second group, you're at high risk for that. You had a calcium scoring test that shows your coronaries are blocked, or you have diabetes, or you have high blood pressure, you have a family history of heart disease and high cholesterol. I have a very low threshold for starting those people on statin drugs. Third group.
Wait, low threshold, you mean what?
I'm going to offer it to them. Okay. I'm going to say, get your lifestyle in order. You know, look, I probably want you on the drug. They'll say, look, I'm afraid of muscle aches. I'll say, try it. We'll see if you get muscle aches. Yeah. You know, there's side effects from these drugs, muscle aches being number one. But the second group I like to treat also. The third group, if you have a very, very high cholesterol, no family history, but, you know, your LDL, your bad cholesterol is over 160, and I can't get it down any other way, with diet, with exercise, no matter what, I would consider a statin drug for those people, too. Those are the three groups. Again, that's not everybody, but in the study, it looks like many people aren't taking it that should be, and that's bad.
David, I mean, do you think it's easy to go to your statin as opposed to, like, trying to lose weight and eat better?
Well, look, the reason why they're not taking it is because, number one, they're asymptomatics. You're not going to, if you don't have heart attack and you're perfectly fine, anybody's cholesterol could be high and they may not know about it. The other thing is the side effects. Over the last couple of years, there has been a lot of studies that talks about the fact that actually these medications can increase the risk of diabetes. Yes, you can take these anti-cholesterol medications, end up with memory loss, confusion, diabetes, muscle pain, and to some very small degree, liver function problems, which if you reverse it and stop taking it, it may go back to normal. And the third one is cost. A lot of people in mid-America may not be able to afford this. Say, leave me alone. If they go ahead and take care of their health and behavioral changes, exercise, diet, I have no problem with that. But look, let me just get one thing out. American Heart Association has new guidelines, and instead of concentrating on the numbers, and I have to admit that Mark deals with this all the time, and he's the expert in this field. As a urologist, I study a lot of this, but I will tell you that if your LDL, which should be the bad cholesterol, should be less than 100, if it's over 190, you're in trouble and you should be taking these. If you have history of heart disease, stroke, or you have type 1 or type 2 diabetes, you should be taking them. If you're also between 45 or 75 and you have high risk of heart attack over the next 10 years, those are the four criteria, I think you agree, that you should be going and taking these cholesterol medications. That's important.
You know, for urologists, he got every part of that exactly right. I only want to contest one thing. The issue of the memory loss with the statin drugs is controversial. They've been studying that. There was a study a few years ago that showed that anything that lowers your cholesterol may affect memory, short-term memory loss. It hasn't been proven. I got to admit, though, a lot of patients complain about that. So it's certainly well worth bringing up. And the risk of diabetes also.
Well, compliance is a big problem because of muscle pain. I mean,
quick question. If you told me I had to take the statin, I also changed my diet in the process, and I lowered my cholesterol number, would you take me off the statin?
I'm the kind of doctor that I don't want you to be on medications unless we really have to. If I feel like you're going to on the way of, God forbid, heart attack, I want you to be on it. But we also have to look at your genetic factors. You know, there are a lot of people that they can do all the exercise, they can eat all the healthy stuff, their triglyceride is still high, they still have genetic component of having hypercholesterolemia. And I hate to sound like an internal medicine doctor, but on those guys,
they don't pay us anything, that's why.
Well, I got my 25 copay.
Family history is so important.
Big role.
You're right. Keep that in mind.
Good
All right,
info.
doctors.
Thanks, Doug.
But if you have cholesterol problem, please call Dr. Siegel. For your PSAs, call me. I just want to make it very clear.
Okay, clear that up. Thank you very much.